Hello, I'm Dr. Mark Baran. I'm the director of the Hospitalists program at Meritus Medical Center in Hagerstown, Maryland. Currently, most tertiary care medical centers and community hospitals in the United States have hospitalist programs. What that means is it is literally a practice of physicians in a hospital that care for nothing but inpatients. The method where a group of physicians would be in a hospital caring for inpatient services on a 24-hour-a-day basis allows primary care physicians in a community to extend their hours and spend more time with their outpatient patients on a 24-hour-a-day basis for themselves too, if it's weekends, nights, or longer daytime hours. In a hospital such as Meritus, which is a community hospital, there are many advantages for having internal medicine or family physicians that are trained to do that role. Because we're here in Meritus 24 hours a day, 7 days a week, 365 days a year, we have a staff that can respond to nursing questions, emergencies, laboratory results in a very timely fashion. To compare and contrast perhaps what a patient would experience with their primary care physician if they would render care versus our physicians. As an example, if there is an emergency, if there is a problem during the daytime hours, it would be very difficult for a primary care physician to leave their practice, rush to the hospital, and get to the patient's bedside. It just would be very difficult. We, on the other hand, could be there literally in minutes for that meeting.
My wife and I talked about it, and yes, we were hoping that we could get my regular doctor, but we just have to flow with it. But as it turned out, it's been working out very well. If there's any fear that they don't have their own doctor taking care of them, I can assure them that it's a good program. It's well directed. I can see, and I think it's going to be very beneficial to everybody.
We have a very strong relationship with the primary care physicians in the community that we serve. Many times we have community bonds that go to the medical staff setting, committees, that sort of thing. But indeed, we share this relationship as a team. We understand that they have a very strong relationship with their patients, that they know those patients and their medical histories better than anyone else. When those patients come to the hospital emergency room or are sent directly from those physicians' offices, we respond really as their surrogate. We're acting in their place. We inform the patients in the emergency room and also communicate with their families that we are communicating with those primary care physicians, getting information, could be medications, drug side effects, pertinent medical history, or other information that we need to know about those patients so we can really carry out the instructions with the advice and consent of not only the patient, but with the information provided by the primary care physician.